Evening. Thank you, Manjari. For those of you who don't know me, my name is Rohan Gupta. I am a participant of one of the self-help groups that Manjari was speaking about, and occasionally I facilitate the group when some of our other members are not available. It is my pleasure and honor to introduce a dear friend and mentor of mine, Dr. M Suresh Kumar, who is a retired professor of psychiatry from the Institute of Mental Health, Chennai. He is currently the head of research and development at Cities Rise, a global platform for mental health. He was a Hubert Humphrey Fellow in Public Health University on Drugs and Crime, the WHO, UNAIDS on substance use and mental health related issues. He's assisted substance use disorder in several countries in South Asia, Southeast Asia, Africa, Central Asia, and the Middle East, has published numerous articles in several international journals, and is on the editorial board of the International Journal on Drug Policy. He is a principal investigator for a multi-site cluster randomized trial involving 12,000 persons who use drugs intravenously across 15 cities in India, supported by the NIH and NIDA. Collaborative research with the Stellenbosch University in Cape Town and the prestigious Karolinska University in Stockholm on mental health interventions targeting 12 to 15 years. On a personal note, he is a dear friend, my mentor when it comes to many things in life, and I couldn't be happier to be introducing him. So, over to you, Doc.
Doctor,
Thank you, Rohan. Thank you so much.
Sorry, Doc. Sorry to disturb you, Doctor. I have to
Yeah.
make few announcement. First, please keep your mic mute. Everyone, please keep your mic mute so that we can hear clearly what Doctor has to say. And second is this video has been recorded. So for our, so that we can watch it later, and put your questions in the chat box so that we can address it after this session is over. Thank you, sir.
I hope the slides are visible. Are the slides visible?
Yes, Suresh ji. Yes.
Okay, thank you. So, first of all, I really like to thank Ekalaiva Foundation, in particular, Rohan, who actually is instrumental in me being in this forum, and Mr. Ganesh Rajan, who have been our guest in our own academic program a few months ago. Pleasure and privilege for me to be part of this group. And I think I have to say, when I was given this topic, this is not something that I normally talk. I don't talk to, like people in this arena at all. This is not my specialty. But still, being a psychiatrist for about 4+ decades, I thought I will really want to really meet up this particular group and talk about some of the things which I think is very essential. So when the topic was given, I was wondering, the first thing that I must be talking is, why should we do non-medical practices for people with lived experience and caregivers? Two very important things: managing mental illness better. And the last thing, I think this has been really request from Rohan. You want to talk, I've been involved in advocacy for a long period of time. So what can we do with advocacy involving people with lived experience and caregivers? So that's going to be my broad outline. So first and foremost, the question number one: why do we need vital non-medical practices for persons with mental illness as well as caregivers? Obviously, medical treatment is essential, and that's the core of any treatment for psychiatric disorders. Having said that, we need these non-medical practices to complement the medical treatment in order to achieve a holistic well-being. When I began my career in the 1970s, our objective when we saw a person with psychiatric disorder is to reduce symptoms, We're only reducing the symptoms, the severity of it, and frequency of it. Today, all around the world, the objective of the psychiatrist is to promote holistic well-being in people they treat. So in order to do that, the vital non-medical practices are very important. Second, I think we need to improve the quality of life of the individuals that we meet, either the people with lived experience or their caregivers. So in order to improve the quality of life, we have to focus on emotional health, social health, and the physical health of the individuals. That's the second important reason. That all can be done with vital non-medical practices. Thirdly, we have so many mental health challenges. I think these mental health challenges can be addressed effectively only when we provide supportive strategies to them. So for the holistic well-being, to improve the quality of life, and to address the mental health challenges by providing supportive strategies, we believe non-medical practices are absolutely vital. So first in the list is managing stress. I think that's very much important because all of us go through stress. Is stress important? Yet it's very relevant in our day-to-day life. We all require some amount of stress for effective performance. There is a connection between stress and performance. And I think it's famously narrated in 1908 by X and Dodson. These two psychologists actually addressed the relationship between stress and performance. It is an inverted U shape. If you look at it, the relationship is, if you have minimal stress or low stress, you are very relaxed, your arousal is very low. And then if you up the stress a little bit more, you become more aroused, more alert. And then at a moderate stress level or a medium stress level, you are performing maximally. That's the optimal level all of us can function when we have moderate amount of stress. So it's important to realize we do require stress in order to perform better. Students, for example, before the examination, and they are very stressed about preparing for the examinations. It's a high stress, they are not going to study well. If they have a medium stress, these are the individuals who are going to optimally perform in the examinations and prepare and do well in the examinations. So moderate amount of stress is required for an optimal performance. But if the stress goes up, and the stress could be becoming distress, and that distress can precipitate symptoms of anxiety or depression, that's when they usually break down and the performance goes down dramatically. So you do require moderate levels of stress in order for a better performance. But if the stress levels are very high, and I think the performance comes down. This is something all of us have to realize. We can't live a stress-free life. That's really not possible. So the most important thing that one would do in order to make sure that the stress is not getting converted into distress is to indulge in physical activity. We all believe very strongly the first line treatment for effective management of stress is increased physical activity. We simply believe physical activity is important for not only cardiac health, but also for brain health. What is good for the heart is also good for the brain. So I think when you talk about physical activity, we are talking about exercise and engaging in this exercise of any kind. It could be walking, it could be doing yoga in a park, or it could be going for a swim. All of these physical activities can be done by any individual. I think the minimum period that is required for an individual is anywhere between 30 to 60 minutes. If anybody practices at least 150 minutes of physical activity every week, that's going to ensure brain health. So what we are really aspiring for is about 150 minutes, which translates to 30 minutes 5 times a day. Nobody can say that I don't have the kind of a time to spend 150 minutes per week. This kind of a physical exercise is definitely a token for a better brain health. So what does it do? If you do that, it certainly improves your mood. It reduces symptoms of anxiety and depression, which is very prevalent in lots of people who undergo stress. And overall, it improves the mental functioning and well-being of the individual. So I think physical activity is very key. Even somebody says, I can't do so much of physical activity like many other people. And I would say even walking for about 5 minutes after every meal is going to be very important. Even just getting out of bed and walking for some time, doing moderate levels of physical activity, mobility, these also can boost the endorphin levels and contribute to a sense of well-being. So one of the things we notice in people with psychiatric disorders is that because of the medication, because of the lifestyle, because of many things, obesity and many things, and I think there is absolutely, in many people, there is less activity. So behavior activation is very critical, and physical exercise is one of the ways of making people to feel better and achieve the sense of well-being. So physical activity is the first thing that I would want to insist on. The second is, I think all of us require a daily routine. And establishing a daily routine is so very important for all of us, because that's the one which can bring stability to the individual. This is the one which can reduce the anxiety symptoms in an individual and provide a sense of control. The mastery should be there on the sense of control, because that can only be done when you have a daily routine. Even if people don't work, they're retired, yet you can form a structured schedule, a day with activities, schedule activities, the rest time, the meal time. If everything's structured, that is what helps individual to feel more organized and less overwhelmed. People who are not very structured, who are not very organized, these are the people who feel very overwhelmed with themselves. I think one of the important things is to establish a daily routine in your life. One of the most important routine and structure in our life is our sleep. We need to pay a lot of attention to sleep hygiene. When I talk about sleep hygiene, everyone, all of us, have to prioritize the regular sleep pattern. It's not only important to have a quantum of sleep. A lot of people say, I sleep about 7 hours. That's good enough, no doubt. But I think it's not enough that you sleep the 7 hours. It's very important. When do you sleep? You have to sleep while your circadian rhythms are on. What does it mean? Anybody who sleeps between 10 and 5 are probably sleeping in the circadian rhythm period. So maintaining the sleep during the circadian rhythm pattern is very important. And having this kind of a regular sleep will also have a calming influence on you. So you need to create a bedtime routine for yourself. You can't be saying that, like in the days where mobile phones are available so easily, many people are spending a lot of time, like in social media, that really disrupts their sleep. So sleeping within the circadian rhythm is very important. This is definitely going to regulate both your mood levels as well as your energy levels. Those who sleep very well during the circadian rhythm are the ones who don't feel very low. They are very energetic the next day. So I just want to talk a little bit about sleep hygiene. Sleep hygiene is very important. I think it's fundamentally next to physical activity. I would give a lot of importance sleep hygiene for everyone, all of us, and also to people with lived experience and caregivers, because I think a good sleep is going to be predicting good energy and good moods. And also we know now for sure, people who do not sleep well, it's a good predictor of depression later on. Children, adolescents who don't sleep well, who don't sleep during the sleep rhythm period, these are the people who are most likely to develop depression later on. So given that kind of a knowledge, all of us have to practice sleep hygiene. What is the thing that we can do? Do not take stimulants after sunset. So after 6 o'clock, you limit your caffeine. If you're a smoker, don't smoke too much of cigarettes after 6 o'clock, because nicotine is a stimulant. Nicotine keeps your brain very active in the evenings and in the nights. So also, many people think that alcohol is a sedative and you can sleep well. Most people would say, if you're going to drink alcohol before or close to bedtime, and there is a disruption in the sleep pattern that occurs even when people drink alcohol. So I think that's very important. Third, these days, I think in the past 20 years, the biggest challenge for most people, young people, adolescents, children, even adults, even older people, the biggest threat has become the digital devices. The mobile phones is a nuisance to a lot of people. People are spending a lot of time in mobile phones, in WhatsApp, in other social media, browsing all unnecessary things, looking at reels. These all can actually disrupt the sleep pattern. So avoiding mobile phones after 7 o'clock in the night is going to be saving you a lot. Maintaining consistent life routines, having the sleep-wake schedule at a proper time, having correct meal times and exercise times, all will ensure a good sleep for you. And I think those people who eat light bedtime snack are better, sleeping better. The environment is also very important, because you need to have a right kind of a temperature in your room. There should be less light. And a lot of people who watch television, having the television in the bedroom is the worst thing that you can do. That is definitely going to be disturbing your sleep. So that's very important. And also, a noisy environment is a barrier to sleep. So you need to have a quietened environment. People, some of us live in a city like Chennai with so much of noise pollution. We're living in the congested places like where I live, like in T Nagar. It's going to be a lot of nuisance. The noise is the biggest threat for all of us, which I think we need to put up earplug and then sleep. So environment is also critical for a good sleep. I will also give some tips for people to sleep well. One of the things that you can do is go to bed only when you're sleepy. You can't try to sleep. If you try to sleep, you're going to arouse yourself a lot. And you can't be expecting yourself to sleep. That expectation will arouse you and that'll keep you awake. So you go to bed only when you feel sleepy. And I also want to tell you, bed is only for sleep and sex, for not any other activity. Nowadays, I think people are doing all the things at home. They lie down and think. They lie down and plan for tomorrow. You'll become a philosopher and a thinker. You do all that. But you're not going to sleep well. And I think sleeping well is very important if you confine the bed only for activities like sleep and sex. You have to get out of bed when are unable to sleep. I think people are spending large number of hours in the bed. Actually, their sleep time is very less. So you need to, whatever time that you slept doesn't matter. You cannot complain and say, I only slept about 2-3 hours. So I'm going to make it up in the morning. So you need to keep the waking up time constant. That's one of the ways in which you can make the sleep-wake cycle to become normal. So you put an alarm and say, I'm going to get up at 6 o'clock in the morning. No matter when you're slept or not, get up at 6 o'clock and the sleep-wake cycle will come back to normalcy after some time. Avoiding daytime naps is very important. Some people sleep large number of hours in the daytime, 2-3 hours, and then they struggle to sleep in the night. I would say anybody wanting to rest for in the afternoon, the nap cannot be more than an hour. Ideally, it should be about 30 minutes. If you exceed about 60 minutes, that's going to interfere with your night sleep. So I think we need to increase sleep efficiency. What does it mean? The time that you are in bed, you should actually be sleeping, not just lying down. One of the things that I noticed with a lot of people, my own patients, with the lived experience is that they'll say, I'm in bed for about 8-10 hours, 11 hours. I think I'm medicated. Actually, do you sleep? They say, I'm not sleeping. I'm just tired and lying down in bed, which is not very good, which is really going to be doing a lot of damage to you metabolically. So I would say you need to restrict the time in bed when you're not sleeping. You get up and probably sit on the sofa. When you feel sleepy, go back and then sleep. Probably sometimes you require a lot of guidance from treatment professionals and family members in order to achieve that. My idea is the percentage of time that you're asleep in bed should increase to time in bed. So that's very important. So I talked about physical activity. I talked about maintaining a daily routine. And I talked a lot about sleep, which I think is very critically important. Then I also want to tell some simple techniques, age-old techniques, which Easterners like us have been following for a long, long period of time. Mindfulness is a technique which is practiced all around the world today. It's almost become like a Western concept. It actually came from our own place. Buddha was the person who really taught us the mindfulness. And I think mindfulness techniques are very important to bring us to the present. All of us like a pendulum. Our thinking is like a pendulum. Either it goes back to the past or it goes back to the future. And when you go back to the past, you're digging up all the old luggage and feel very low. And you go back to the front and forward and think about your future, you're feeling very uncertain about it. But you're in the present. And I think it really reduces your stress levels to a great degree. So mindfulness practices are very important for us to bring the brain to the present, to bring the mind to the present. So then you watch your own thoughts without judging it, without attaching any emotions to it. This is the best way you can actually regulate your own emotions. So I would strongly recommend, because a lot of people teach you mindfulness, and I think there are very simple techniques available. People practicing mindfulness can come to the present and reduce their anxiety and stress levels a lot. I think caregivers in particular can be benefited a lot, or people with lived experience anxiety can be benefited a lot by going through these mindfulness exercises. Other techniques are available. Simple things like relaxation techniques. This is again part of the yoga. And I think we have been teaching the whole world on this. And I think this is extremely important. Breathing is central to all of us. And deep breathing is a way. By deep breathing, I mean you take a deep breath in as long as you can. and slowly breathe out. This deep breathing practices will certainly help you to calm down a lot and bring your mind to the present. You watch your own breathing, you control your own breathing and make it a deep breathing. And this is one of the important things that you can do to attain relaxation. The second thing is psychologists will teach you what we call as a progressive muscle relaxation. This comes from a very simple principle. When the mind is tensed, your muscles are tensed. When the mind is relaxed, the muscles are relaxed. It's very difficult to control the mind, but it is easy to control the muscles. If you know how to relax your muscles at will, your mind will also get automatically relaxed. So one of the things that you can do is to practice this progressive muscle relaxation technique called the Jacobson's progressive muscle relaxation technique. And the psychologist will teach you, any YouTube video can teach you. You learn it, you know how to relax your muscles at will, and you know how to relax your mind easily. And the third one is a guided imagery, where like in a hypnotic trance state, you imagine very pleasant things as you're in a park with your pet dog.
भाई आप आ रहे हैं क्या इधर?
Thing
अच्छा खाना
will
खा रहे हो?
and relax you very well. So practices such as deep breathing, progressive muscle relaxation, and guided imagery are simple ways to relaxation techniques. And I think all these can help to reduce stress and improve your emotional well-being. So having done with physical activity, routine, sleep, and mindfulness and relaxation exercise, you also have to talk a little bit about creative and recreational activities. I think this is very important for us to understand today. Creative activities can help us to feel emotionally better. For example, people who indulge in creative outlets like drawing, painting, or writing, or playing music, all this can allow the person to emotionally express. And this is the way you can process things in a non-verbal way. You don't really think that we have to emote ourselves only in the verbal way. A lot of this emotional expression can come through the non-verbal way. And I think creative activities like drawing, painting, and writing can be easier options for us. The second important thing is we have to develop hobbies and interests. Those who have participation in the hobbies and leisure activities, it brings a sense of accomplishment to them. These are the individuals who say, I've been doing this stamp collection, coin collection, I do this gardening every day. And I think these are very important activities that gives them a sense of accomplishment. This helps them to distract from the negative thoughts and improve the overall well-being. These are very simple things that you can build into your own everyday life. And I think we also have to think about food as a very important thing. Food is very critical. What we eat really determines how our moods are, how our brain functions. We do know at the moment that I think the food is a very important factor. As mental health professionals, we know the relationship between gut and mental health. Gut is the second brain, we say. So I think the food is also becoming very important for us to feel better. We talk about a healthy diet. A healthy diet is typically a diet which is a plant-based diet. We talk about a diet which is rich in fruits, vegetables, contains a lot of whole grains, and lean protein. And I think the Mediterranean food is also pretty good because Mediterranean food contains all this, as I said, plus some of the people who can eat meat and fish, they probably eat fish. Fish is the best thing in that Mediterranean one, and they can contain it with olive oil. For many of us who are in taking plant-based food, and this is a very healthy diet. So what we have to avoid is we have to avoid and limit processed foods. The processed foods are very dangerous, not only to the body metabolically, but also to the brain and the moods. So eating less sugar and not drinking excessive caffeine, all will help you with the mood and improve the mood stability. So that's simple thing that we can follow. And I think all of us have to hydrate ourselves very well. Drinking water, enough amount of water is very crucial for maintaining the energy level as well as maintaining the clarity. If you don't drink water for long hours, and I think sometimes you talk in a very jiggery way, obviously because you're lacking in the mental clarity. This is something we always knew intuitively, but the science behind engaging with nature is slowly emerging in a very big way. And I think if you engage in nature, which means if you are going to be spending time in nature, I think many people are talking about green cities nowadays. Unfortunately, we are not living in cities in India where it is really green. The green spaces are missing. The parks are missing. And I think we really need green spaces because those are the ones. You go to a village, you go to a place where there is nature, and that kind of a visit can reduce your stress, improve your mood, and hence your overall well-being. All of us, if we have a chance, I think we should walk in the park, a park that is full of trees, and carrying out some outdoor activities, or even simply if you have a luxury of having garden in your house and doing gardening, all this have a very therapeutic effect. This apart, I think one has to address one's own self-esteem in order to improve and manage stress better. So, what is the way to improve self-esteem? You need to set yourself a very realistic challenge. One has to become very assertive. A lot of people don't know that art of not saying no at a time when you actually have to say. When somebody comes and pressurizes you to do certain things you don't want to do, we are a little bit, worried about asserting ourselves and say, I can't do this. So we need to be assertive in order to improve our own self-esteem. If you're not assertive, it shows that your self-esteem is also very low. People who are confident about themselves are able to assert themselves better. One of the ways of improving self-esteem is never compare anyone with anyone else. There is nobody, you're unique and you can't be compared with anybody else. So you need to stop comparing people. I think, as I said earlier, engaging in hobbies will also one way of, making sure that, you improve your self-esteem because it gives you a sense of accomplishment. You need to spend time with your own family and friends. And that's one of the ways in which you can certainly improve your self-esteem. And helping someone else, being altruistic, helping someone else is also another way of, improving yourself and improving your self-esteem. So these are some of the things that you can do in order to achieve self-esteem. Okay. So, sorry, I have some struggle moving the slide down. Yeah. So, other one is building resilience. I don't know how many of you heard the word resilience. Resilience means when you face any trouble, your ability to bounce back is called as resilience. And I think a lot of communities have inbuilt resilience in them. All of us have inbuilt resilience in us. But some of us, due to continued pressures and struggles and stressors, can begin to think that our resilience is slowly failing. People who have better resilience are able to cope with things better. So one of the things we can do is to develop proper adaptive coping techniques, adaptive coping strategies. And I think this will encourage positive thinking in the individual, which helps them to bounce back whenever they are in trouble. This is a very important factor. In the past 5 years, I've been actually focused on building resilience among young children. If you look at the brain is a developing organ. It develops from 0 to 20 very much. And in the middle years, between 12 and 15, people, this is a tricky stage. You are neither a child, nor you become an adolescent. 12 to 15 is a focus. Many people don't focus on these people. These are in the 6th graders, 7th graders. People don't worry too much about them. I think we need to build resilience in this middle-aged children very much by actually giving them the strengths. We do what we call as a character strength program, in which two people, a guided program, which is delivered through art and theater. And we talk about 3 important ingredients of character: gratitude, kindness, and hope. Gratitude that relates to the past, kindness that relates to the present, and hope that relates to the future. If you combine these 3 character strengths together, roll it, and give it as a program, which is art-based and delivered into the in-classroom settings through young facilitators, this makes a huge change in these children. We believe these are the ways in which you can build resilience in these people. Resilience can be built in people by so many programs. And I think even allowing the children to celebrate small victories. And then, also hope is very integral to develop this resilience. So building hope in these people is very important. A lot of children feel very helpless and hopeless at this point in time because the situation they are in, the context they are in. Giving them hope is very important. The same thing applies to people with lived experience and caregivers too. I think giving hope to them is critically very important. And the hope is the one which can build them and help them to develop adaptive coping strategies and build resilience, which is very important to deal with struggles in life. And I think never not mention about spirituality. And I think maybe I'm 70 and I talk about spiritual practices. And I do believe even young people are very spiritual these days. because I did not pay so much attention when I was young to spirituality. As I'm getting older and older, we realize the importance of spirituality and its relationship to mental well-being. And I think when I went into the substance use world, that's when I figured out how spirituality becomes so very important for people with lived experience of substance use, how it helps them. For individuals who naturally find comfort in spirituality, there are a lot of practices that are available. You can pray, you can meditate, attend religious services, read spiritual texts. All of them can really help them to calm down and get that emotional support. What really happens in the spiritual practices, a lot of them are part of a commune or a community. They join a bhajan group, they join a group of people. And I think it makes them to connect with each other. It's not just that spirituality that binds people to God, but also to other human beings. And I think they feel the connection to a larger community. For those who do not believe in God, and I think we say in the AA meeting, God is good, orderly direction. I think that's also very important. If you just follow a good, orderly direction, that's also going to be very important and spiritual. Spiritual practices can certainly enhance your mental well-being. Finally, I think the relationship with other people is vital. What we call as social connectedness. After all, human beings are social animals. We need to connect with each other. So all people with lived experience of mental illness and caregivers, we need to increase the social connectedness among them. Encouraging participation in social activities of any kind, reunion with families and friends, or joining some small clubs or community groups. Certainly, it will help you to reduce the feelings of isolation and loneliness. There are so many people out in the world who feel very alone and isolated and alienated. It's extremely important for us to connect socially and reduce these negative feelings. Building these supportive relationships can actually provide emotional support to individuals. And when caregivers come together and have a relationship, this certainly reduces burden among them. I've seen a number of people. I used to run family anonymous groups for long periods of time for nearly 3 decades with people with substance use. I think for families I used to run. And I used to see when they come together, they used to look forward to such kind of groups because it reduces the burden among them. And I think fostering positive connections will certainly make people to understand better, and it actually, encourages positive mental well-being. So I'm going to be done with the stress management. I think I've spent a lot of time on stress management, which I think is very important for all of us, with people with lived experience as well as with caregivers. Now, let me say something about some tips to manage the mental illness better. The first among is the education and awareness. We term it as psychoeducation, which literally means we need to educate people with lived experience about the nature of the illness, the symptoms of the illness, and the various treatments that are available to them. This knowledge is vital for them. People should know what they're suffering from. What is the nature of it? What's the trajectory of it? What are the various signs and symptoms of the disorder? How does it go over a period of time? What are the various remedies that are available to them medically and otherwise to them? This knowledge is pretty important. A lot of time, doctors are very busy. They don't spend time with the patient explaining to them about this. Psychoeducation, in my opinion, is a first step to treatment. The psychoeducation will help people to understand that they need to be on treatment. And I think they also will have realistic expectations from their therapists and the doctors. This informed support is very important for people with lived experience. So I would insist receiving psychoeducation and becoming aware of your own illness and their experience is critical. Second, I think the education is also required for the caregivers. And I think it's important that the professionals tell the caregivers about the illness, about this disorder, and what are the options that are available. This not only helps the caregivers to understand about their loved ones, but also they are in a better position to help their loved ones. And it also helps them to maintain their own well-being. Not knowing about the disorder is very painful. And sometimes they are in the dark. They just don't know what the outcome is going to be. What are the various options? And I think it's very important that we provide that to them. Psychological support is key. I think medical treatment is available from mental health professionals. That apart, I think we should also provide psychological support. There are many types of psychological support. Top among them is what we call as a talk therapy or a supportive psychotherapy. It's very important that people have the safe space available to them to talk. They should be in a situation to go and sit with somebody. That's a safe space. They're not going to be questioned. They're not going to be confronted. And they'll feel free to talk about what they have in their mind. The therapeutic alliance that we are talking about between the therapist and the patient is very important. And that should be one of empathy and compassion. The active listening should be accompanied by empathy and compassion. It's extremely relevant and important that we provide reassurance to people and explain to people about the nature of the symptoms. They need explanation. What am I experiencing? Why am I thinking in this way? Why am I mood like this? Why my thoughts are going in this kind of a direction? I think we need to sometimes explain to them and reassure them. You give them the space to ventilate whatever they've gone through. A lot of them have gone through very good, very important trauma in their life, childhood trauma and other things. They want to talk to somebody in that space, allow them to ventilate, allow them to catharize. It's also the role of the psychotherapist to guide the persons appropriately and provide the emotional support that is required for them. One of the very popular therapies is cognitive behavior therapy. Cognitive behavior therapy, even though it's originally designed for depressive disorders by Alan Beck, I think it's also relevant for people with lived experience of psychosis too. Employing cognitive behavior therapy can help individuals to identify some of the unhelpful thought processes and the distress caused by the hallucinations and delusions. And that can be addressed with proper coping strategies for better symptom management and prevention of relapse. So cognitive behavior therapy is also available from learned psychologists who can trained psychologists who can provide the support to them. One of the very important things that I am very fond of and I think recommend strongly is family therapy. Because in India, unlike in the West, I think people live in families. There's hardly anybody who find that he's not having any kind of a family support. There is always a woman behind the person with the lived experience, either the mother or the wife or the sister, who are the backbone of the person to provide the support. So involving the family is very much invested in the person and they want to really help and guide the person. So family therapy involves both the person with the psychos as well as their family members. We can improve the family communication with each other. That can reduce stress a lot and each of them can provide mutual support for the other. And the families also are able to better understand the condition of the person. They're able to manage a crisis and support the recovery in a healthy way. So I think family therapy is one thing that we can all do and help people with lived experience and their caregivers. And also I want to say that there are very specific conditions for which psychological therapies could be done. One is what we call as treatment literacy. A lot of people don't know about treatments. What are treatments available? What does this medication mean? How long do you require the medication? What kind of a support is available other than medication? If somebody suggests something like, other neuromodulation techniques, what does it mean? Is it harmful? Is it beneficial? There are a lot of things that people don't know. And I think it's very important for us to create that treatment literacy in people with lived experience as well as their caregivers. We have to tell them the options that are available, the benefits that would accrue because of the treatment, the risks that would come out of it, and wait accordingly and take a decision. It should be a very partnered relationship. It's not that the therapist decides everything and then pushes down the throat of the person with the lived experience. It should be a consensual agreement between the person and the patient and the family at times. Adhering to the treatment is also critically important for a chronic disorder like mental illness. Often, unfortunately, mental illnesses are chronic and enduring. It runs for long periods of time. So we have to provide treatment like for a chronic disease model. And so providing the treatment support, adherence support is very critical. And probably sometimes they require treatment adherence counseling for them. Otherwise, people will drop off after improving. I think I became better in 3 months. I thought the treatments were not necessary. After all, I had some medication-related side effects. So it dropped it off. A few months later, the relapse comes. The relapse is worse than the first episode that happened. So obviously, we need treatment adherence counseling to individuals. Sometimes social skills training also is helpful. people can have challenges with communication, or problem solving, or relationship building. Some of the people with chronic disorders can go through these problems with communication, problem solving, and relationship building. I think we can certainly provide the social skills intervention for people with psychosis to improve this. One other thing that social skill training does also to reduce the social isolation and improve the functioning in daily life, because daily functioning is also very critical. So understanding the whole process of social skills training by the caregivers can also help them in their own supportive environments. This is a relatively new concept that is emerging in the field of mental health, but I've been working in the field of substance use for over 4 decades. This is by my crux. Always believed the peer support is very critical in the field of substance use. And if that was helpful in substance use, I'm sure it will also be helpful in people with mental illness too. And I think people with the lived experience of mental illness should get the benefit of peer support. And it offers the individual psychosis the opportunity to connect with others. They can easily identify and say they have similar challenges. It brings a sense of belonging. And I think peer support is one thing that can definitely reduce the stigma. I'm so happy Ekaleva Foundation, one of the key objectives, I was listening to Manjari yesterday telling that one of the key objectives of Ekaleva Foundation is to foster peer support. And I think I'm very glad and I want to congratulate you, because through peer support, you can certainly mitigate stigma to a great extent. Caregivers also will benefit from peer support groups because they share the experiences, learn about coping strategies from others, and gain emotional support from similar caregiving, like people. I think that's very important. I'm very, very, very happy that this has become one of the important mandates for Ekleva Foundation. Some of the people, unfortunately, employment is important for everyone. But I think we talk about employment, we should also include people with lived experience. Many of these people will require supported employment. I think these programs will certainly help them. If you are a school student, we have to help them to return back to school or college. If you are in the work, we have to help them to get back to work. And I think workplace environments are very insensitive to the needs of people with lived experience. They're becoming a little bit more aware of it at this point in time. So we need to work a lot with these people. And I think we need to do a lot of advocacy. That's when we require advocacy with lived experience people and their caregivers. So at SCAR, we've opened up a program called Employment Exchange, where people with lived experience can actually register. And we try and work with some workplace and we actually find whether the job is suitable for them and match them accordingly. So such kind of things are very innovative programs. It's done with Chennai Psychiatric Society in association with SCAR. And I think this is a huge support that we provide at this point in time. Similar kinds of supported employment and education programs should go on in future for people with lived experience to get proper jobs. Fortunately, in this country, many people don't live home without any home. Many of them live at homes. But for so unfortunate individuals who don't have housing, the homeless, psychiatrically ill, I think the supported housing services are important. Banyan has a program where they have this home away from home kind of a concept where they put people in and make them to live in a structured way. Also very important for us to think, the caregivers in particular have to set boundaries and manage expectations. They have to set clear boundaries. If caregivers should establish clear boundaries to protect their own mental well-being, it's not possible to do everything. You need to be realistic about it. Because if you want to take and protect everything and do everything, you certainly can, be burdened. And I think I don't want people to go through a sense of guilt that they were not able to do that. I think setting up these clear boundaries, what is my role? What's the role of the doctor? What's the role of the professionals and other people, support groups? So we need to really make out these boundaries very clearly, setting limits, and also taking help when needed is also very important. One has to have very realistic expectation about recovery. Sometimes we are too optimistic about what will happen. That also can be very, very, negative. So you have to be very realistic in what we can make. Dialogue with people, open dialogue with other people, people with lived experience, caregivers, and professionals would actually remove all those setbacks. Some of the caregivers might require some break, to avoid burnout. So they need to have regular breaks. Sometimes you need to, allow someone else, maybe even short-term hospitalization sometimes is helpful for the caregivers because at times they can take care of themselves. So this kind of things are available in the West a lot. I think we are definitely finding that very useful even in this country. Last, I think we need to also talk about what we can do with people with lived experience. I think people with lived experience are not just beneficiaries. They are equal stakeholders and they play a significant role in improving the whole well-being of people with lived experience. So I think this advocacy is very important. And I think one of the things that you do is when you have an advocacy group, I think it can have a lot of advantages. One thing is, you have a group of people with lived experience coming together. This gives them a sense of empowerment and representation. This is what is happening in Ekaleva Foundation. I'm so glad this is happening. So this is very important for anybody's well-being. Certainly, people with lived experience can advocate for improved services for them, because medical doctors for a long period of time have been only focused on providing treatment, medical treatments. They've not been addressing the other needs, other vital needs of people with lived experience and caregivers. So in order to provide a comprehensive package, I think the advocacy with people with lived experience is important. That's the only thing that can improve services and support for them. As I said, the peer networks, if that happens, that's going to go a long way, not only providing support, but also to reduce the stigma. I believe in the journey of managing people with chronic mental illness, we need to have a holistic approach. The promotion of holistic approaches can only happen when we have advocacy with people with lived experience. Because when doctors talk, they talk from a clinical perspective. When psychologists talk, they talk from that perspective. But when people with the lived experience and caregivers talk, that account is authentic, accountable, and that can lead to very sustainable approaches for them. I believe one of the things that has not happened in this country very much is the lack of awareness about mental health and mental illness among the public. And I think when you involve people with lived experience in this process, we are definitely bound to have more public awareness about this. Because when champions who are recovering go and talk about what has really happened to them, and I think it's a different story altogether. It increases the public awareness. I'll give you a simple example of what we have done. We were doing a school-based program. And one of the objectives in the school-based program is to improve the literacy about mental health. We wanted to employ and then study it in a trial, in a randomized clinical trial. Randomized clinical trial, for those who do not understand this word, is a way to find out scientifically whether something is going to be working better and what the benefit out of it compared to something else. That's a gold standard to prove something is really beneficial. So when we did this program in the school, we wanted to know, by just providing mental health literacy education to children, is it going to increase their knowledge and improve their attitude towards mental health and reduce the stigma? I thought about the design in a way that in one arm, we had only mental health literacy intervention. In another arm, because I came from the background of substance use, insisted that people with lived experience go and talk to school children. So people with lived experience were taken to the school, and there were 3 sessions in which the children interacted with them. This was a fascinating experience for the children. Children knew a lot after interactions with these people with lived experience. They actually were imagining about mental health in a very different way. Their stereotypic thinking was very different from the movies and films that they've seen and stories that they've read. When they actually saw and interacted with the person with the lived experience, their whole thing changed. And it showed up in the trial. We just recently published, I would say that a week back, we got it published, saying that people who received the benefit of what we call as a contact-based education, when individuals had a contact with the person, real person with the lived experience, their attitude towards mental health changed tremendously than just giving education. So I see the power of people with lived experience and what they can do to increase awareness and literacy among people. Also, a group of people with lived experience can actually inform policy development, which is very much lacking in this country. Policies at this moment are not very favorable for people with the mental illness and their families. And I think it's very important that the advocacy efforts are taken strongly. Lastly, as the mandate of Ekleva Foundation is, all these efforts would certainly reduce stigma among people. So finally, I know I've talked way more than what I wanted to talk. And I think I thought I should confine my my talk to 30 minutes, and I think I'm sorry that I exceeded. But as a final thought, I want to say it's been a great privilege for me to be here. But I want to say, when Ganesh asked me to speak about non-medical practices, I thought about it and I said, you have to provide a holistic approach to mental health care. And you need to address the emotional, social, and psychological needs of the people. And for that, these non-medical practices are absolutely vital. They not only complement the medical treatment, but they actually promote coping skills of the individuals, makes the individual become resilient and become very much self-aware. These practices can actually empower individuals to manage their own conditions better, beyond medication. I think there is life beyond pills. Pills are very important. There is no doubt about it. It's not just the pills which is going to make life better. Pills will reduce the symptoms. Pills will reduce the symptoms and reduce the severity and the frequency, and to a certain extent address the improvement. But I think if you are looking at recovery, you need to really empower people to manage their own conditions. And that has to be done only through these non-medical practices. More importantly, they can foster social connections among people, with other family members, and certainly it will help to reduce stigma. And I really believe in order to achieve overall well-being, we need to practice at least some of the things that I talked about, because what we require is a very comprehensive, person-centric treatment that is possible only when the medical treatment is combined with this vital non-medical practices. Thank you very much for the opportunity. I deem it a privilege. I'm happy to answer any questions that you have. Thank you.
Thank you so much, Doctor. Could you post your questions in the group? We still have a little time. It'll be great if we could just get this off the ground and wrap up in a time where the doctors is here with us. Thank you. Please post your questions in the chat box.
We have one question in the chat box. It says, how to stop lapse and relapse of bipolar disorder? It happens even if I am taking medication regularly.
Okay. It's a great question. It's a challenging question for any treating doctor. By definition, bipolar disorder is a disorder that comes in episodes and has a famous tendency to recur. There are some fortunate individuals who have long intervals between episodes. But there are unfortunate individuals who have very frequent episodes. Sometimes the episodes come so often and so frequently. The best way to manage bipolar disorder is to take what we call as mood stabilizers, however erroneous that name is. Those mood stabilizers, typically drugs like lithium, a very gold standard drug, is capable of reducing the recurrence in this disorder. So we believe lithium is an ideal drug that would help people to stabilize and ensure there is prevention of relapse. When I say so, there are always individuals who don't respond to this medication. Despite good adherence to medication, they do it. So the first thing that we need to ask is, when somebody is relapsing very often, are they actually taking the medication? Is somebody really making sure that they are adhering to the medication? If they do so, the second thing we have to look at is it an adequate dose? It's not just the drug is important, the dose is important. In the case of lithium, for example, maintaining the serum lithium of lithium is more important than just the dose. So if the doctor is asking for a serum lithium periodically, it should be within a particular limit. But it's not there, it's not going to be therapeutically optimal for this individual. Those are the basic things that you do. And you do know very clearly one of the important reasons for relapse in individuals is the stress factor. Mood disorders have a very strong relationship to stress. Stress can precipitate symptoms in these individuals who are even while on medication. So we need to examine and say whether they are facing constant pressures, stressors. The stressors are usually of an interpersonal kind. constant conflict with some family member or some family conflict or work-related stress, I think we need to really examine and figure out whether these interpersonal stressors are contributing to it. What are the things that I see? Because I work in the field of substance use, bipolar disorder often combines with substance use. And substance use is one of the important reasons for them to relapse. And I think addressing the substance use is also important. So some of the things that we need to look at is, first of all, understand why the relapse is occurring. What is the reason for the relapse? Is it purely medical, or it is other reasons like stressors, or substance use? Then all these are ruled out. Probably you need to take it at, I think sometimes these things do happen, and sometimes we need to combine medication. We need to give more than one, and also combine medication with psychological therapies and family therapies. So a comprehensive therapy will be more useful to them than just taking the pill alone in this particular person. I know I've given a long answer, but I think he also has a OCD, and that's what I'm saying. Some unfortunate individuals have more than one disorder. It's not necessary that one should have one single disorder. And I think that sometimes they have more than one disorder, what we call as comorbidities. When somebody has a comorbidity, and I think it becomes difficult to manage. But I still think we need to manage all the conditions. If the person has a bipolar disorder and a OCD, we need to manage both the conditions. And it is sometimes tricky because OCD is traditionally managed with an antidepressant. An antidepressant can switch the disorder to another episode. So we have to be very clear in choosing drugs which are not going to switch the mood. I'm sure SCARF can certainly help, and I can actually help you to connect with the right kind of a medical doctors within SCARF. And I think I'll be happy to do that if the individual contacts me, and I think I can do that. What exactly is the meaning of guided imagery? No. So what you do is, I am sitting here, and I think I cannot just imagine, right? I want to relax. The guided imagery is the one that we do to make a person to relax. This is one of the relaxation techniques. To make it very simple, the person who's actually taking him to relaxation puts him into a hypnotic state. The hypnotic state can be achieved by suggestions, and then simply when the person is in that hypnotic trance, he or she becomes more suggestible. In that suggestible state, the therapist is telling him to imagine a very relaxing situation. To me, if I close my eyes and if I'm a nicely hypnotic trance state, if somebody is suggesting to me, my therapist says, please imagine a situation in which you feel the most relaxed. I'll think of being in a park with my pet dog, playing with it all by myself. And that's the one which is going to give me a state of relaxation. So this is exactly what so through guided imagery, people can actually make people to go into state of relaxation, and then they can recollect that and relive it in their real life. So those are simple techniques. That's not the only technique. The powerful techniques are simple breathing and Jacobson relaxation methods. These are the ones that are very well done. These are usually done in the past, but nobody attempts this guided imagery and all these days. I think we teach people to do simple breathing, because watching your own breathing, controlling your own breathing, and the deep breathing is simple way to relax. And I think typically the Jacobson relaxation technique is very useful for people who cannot control this deep breathing very well. Some people struggle to do this deep breathing. In those people, I think the muscle relaxation technique is, I would strongly recommend those two things for anybody. Are there any questions?
Doctor, as a volunteer in Eklavya Foundation, the repeated question which we get is, if person with lived experience is taking medication, there are few side effects where that person sleeps for a longer time, and it becomes little difficult for them to follow certain routine. So they cannot get up on time. So maybe they sleep for 10 hours, 12 hours. So they feel it is difficult for us to follow certain routine. So what will you tell them about this?
Okay. Let me say this. If I have a patient who comes and tells me that she or he is sleeping longer hours, and I think I will say, okay, is medication responsible? Often medication is the offender, because many medications can induce sedation. So I will review the prescription. and I say, does this person require the sedating drug in that particular dose? Would a dose reduction be helpful without precipitating symptoms? So you need to do a balance act. Reducing the dose abruptly can actually precipitate symptoms. You don't want that when the person is stabilized very well on that particular medication and dose. So one cannot be adventurous in changing it. If I can reduce a little bit, that could have a significant impact on the individual's sleep pattern and time. Or if the person can be adjusted to another medication, which is equally working very well for him, that is also very good, because there are so many non-sedating antipsychotics that are available in the market. So the doctor who's treating him will decide what would be ideal for him. Even after all that, the person is sleeping for 10 hours. He's okay. It's fine. Still, there are 14 hours left in the day for him to do very useful activities. And I think what you need to do is, he sleeps most of the 10 hours during the circadian rhythm period, not exactly during the daytime. The problem comes when somebody is sleeping during the daytime. Many of our people with the lived experience, if you really walk through what they actually do, a lot of them are spending time sleeping in the daytime. That is what you need to avoid. That is what you need to avoid. I tell them behavior activation is a very simple thing that will help them not to be lying down in bed. So tell people you need to get up and walk, need to get up and move around, do some routine activities, participate in household activities, go to the market and buy some vegetables, do certain things. By doing that, that daytime drowsiness will come down. And I think whatever they sleep, the 10 hours can be in the night time. That's okay. If you sleep by 9 o'clock and then get by, like 7 o'clock in the morning, you are sleeping for 10 hours, that is acceptable. And I think that's not going to really produce a lot of problems for them. So I think that's the way we need to address that. So a lot of them don't sleep well in the night because, one of the things that is associated with chronic disorders like schizophrenia is tobacco smoking, right? So you will see the relationship between the two very strong. And I think sometimes, that's the reason why they are awake so much in the night and then sleeping during the morning. So we also work on, tobacco cessation program with them.
Sir, next question.
Yeah. So there are issues about substance use, psychosis. I really don't, it's very difficult to comment on such a very short thing because there are so many details are missing there. But all I want to say is the relationship between psychosis and substance use is very strong. And I would say this very clearly. Certain substances can induce psychosis. Certain substances can precipitate psychosis in a vulnerable individual. Certain substances can perpetuate and maintain psychosis. So substance use is so very important in inducing, precipitating, perpetuating, and exacerbating symptoms. So it is a no-no to everyone with the lived experience of psychosis. Drugs typically like methamphetamine are notorious to produce toxic psychosis. Drugs like cannabis can also induce psychosis in vulnerable individuals. Even alcohol use can produce psychosis in vulnerable individuals. Now, typically, if it is substance-induced psychosis, if a substance was entirely responsible for the psychosis, cessation of substance, abstinence from the substance will bring down the symptoms and they'll come back to normalcy. But if psychosis persists, we have to conclude this person was vulnerable and susceptible to psychosis, which was precipitated by substance use. So that's the way we differentiate. One was a substance-induced psychosis, which settles with abstinence. Another psychosis persists after substance also, which means it's a psychotic person who's vulnerable for psychosis. The substance is only precipitated it. So the treatment becomes entirely different. So they require treatment in the long run. So somebody is asking about schizophrenia. Schizophrenia, in my opinion, I don't know whether schizophrenia or schizophrenias, because it's such a group of disorders. Like one would not be very similar to the other person that you're talking about. No two individuals are the same. They're all having a unique experience. First of all, let me insist and say it is a brain disorder. We have a brain behind schizophrenia. It is not a disorder which is caused by some magical religious things or some, all these things are absolutely wrong. This is a science-based brain disorder. And we are trying to understand the brain behind schizophrenia very much these, like in the recent years than ever before. Genetics can certainly play a role. I think it increases the vulnerability towards this illness. Certain things have been, figured out. Mostly this illness begins during adolescent and early adulthood. Once a diagnosis is established and we know for sure this is schizophrenia, it often runs a long term. But fortunately, from the time that I entered psychiatry in the 70s to now, the treatments for schizophrenia have become more effective because we have treatments today available which are not only producing the right kind of efficacy on them, which means people are responding to the treatment, they are having remission of symptoms, they are leading towards recovery. But what is really happening is they are having drugs which have less side effects. The side effects that we had with the first group of drugs that we used in the 70s were intimidating. Many of them had permanent side effects due to the medication. You come to my clinic in the 1970s and 80s, you could see who the patient was by looking at them because they had some peculiar movements, peculiar things which are induced by the medications. Today, when people come to the clinic and say, who is the patient here? When people walk in, I ask them, who is the patient here? I don't know. I can't say who's the patient. When caregivers and patient come in, I can't say this because, we have medications which do not produce debilitating side effects. Yes, we have side effects still. We are not saying that we have come to a stage where we have medication with no side effects, but I think they are relatively tolerable. So we have effective medications. So schizophrenia is essentially becoming a treatable disorder. It's not becoming a curable disorder. It's a treatable disorder. Like diabetes or hypertension, it's a chronic disease. We can manage effectively. I want to insist, it is not just antipsychotics that are important. They are very important. Apart from antipsychotics, we require a comprehensive treatment for them. At times, they require psychological treatments. Sometimes people do not respond to medication. They might require neuromodulations for them, and the neuromodulation may be helpful. Often, it's a challenging disorder because of the very nature of the disorder. It occurs at a very early age. It occurs at the prime time in their life and takes a lot of time. People not able to finish school, not able to finish college, not able to sustain their work. This has a very serious impact on their life, personally and socially. And I think that's when the involvement of the caregivers become very important. But I would say the outcome of the illness has become very different over the years. And quite a lot of people with lived experience of schizophrenia, some of my own clients are doing excellently well with treatment. They are educated, they are employed, they are married, they are leading normal life. With all the guidance, I think, this is happening. I'm sure groups like this would be extraordinarily beneficial for people like this.
I think it's almost 8:10 and doctor's patients are waiting there. He's in the clinic. So I will request Ganesh Rajan to say a vote of thanks.
Just that one thing I want to say, because I don't want to disappoint Mr. Kale was asking, is OCD a treatable disorder? Very much yes. Like I said, OCD is also brain disorder. And OCD has very definite anti-obsessive medications. And quite a large number of people suffering from this condition. We used to say in my 1970s, our joke used to be, if you don't like a colleague psychiatrist, what do? You refer a OCD person, because OCD that time was not treatable. And I think people used to struggle. People with obsessive compulsive disorder, if you know the nature of the people, they come and sit with you and then tell their stories for an hour at least. So, and I think we used to say, we don't know how to deal with them. And today, OCD has become a very treatable condition. It will be a very secretive condition. People used to hide it for long periods of time and no treatment was effective for them. Today, OCD is very eminently treatable. So I'm glad the medications are available and very effective medications are available for OCD. OCD combined with behavior therapies. I think behavior therapy is also very important for, there's something called, behavior with very specific therapies that are available for OCD. And a combination of this with the medication would do to majority of the individuals. Those very, very few intractable disorder people would also benefit with other neuromodulation techniques. Yeah, I'm going to stop here because a question like mutism is a very difficult medical condition. I think we just have to deal with it in another symposium. I'm sorry about that. Yeah.
Okay. Over to you, Ganeshji. Thank you, doctor.
Thank you so much, doctor. That was enlightening to say the least. And it is just mind over matter kind of thing. And it is something which is really applicable in the realistic sense, and not something which is pulled out of the sky. And it has a strong foundation and basis. And this is really exciting to know. And thank you so much for sharing all this with us. And I look forward to basically catching up with you in other forums. And thank you for gracing this forum with your presence and your ideas. Thank you so much.
Thank you, Ganesh, Rohan, and Manchuri. Thank you so much.
Thank you,
Take care,
doctor.
everyone.
Thank you, everyone, for joining this.
Thank you.